Thanks so much, Sylvia, for that introduction. And just a big thank you to the Cooperative Memorial Society for the opportunity to come and speak to all of you. And a big thank you to all of you for sticking around for this presentation. Just going to share my slides here. I'll just be speaking on this topic, as Sylvia said, of getting the care that's right for you and how advanced care planning and palliative care can help you as Albertans. And I'll just be kicking off today with a quick summary of what I hope to cover in the next, hopefully 20 minutes or so. And so for those of you who might be hearing about the Palliative Institute for the first time, I'll provide some background on this as well as the role of Covenant Health here in Alberta. And then we'll move into this topic of advanced care planning. And this term might be familiar to some of you, and to some of you it might not be, and that's okay. And the good news is that as members of the Cooperative Memorial Society, you're already engaged in it because funeral planning is an important component of advanced care planning. So if the term is new to you, I hope you find this section informative. And if you're well acquainted with advanced care planning, my aim today will be more to provide you the background on the many processes it encompasses so that you might be able to encourage your family, your friends, or others in your network who might not have given it as much thought as yourself. And then next, we'll move into a discussion around the comprehensive care that the term palliative care includes here in Alberta. And I'll provide some information on the palliative care resources that are available to you as Albertans. And hopefully we'll end with plenty of time to answer any of the questions you might have as we work through this presentation. I won't be able to keep an eye on the Q&As as I work through the slides, but please do feel free to ask your questions there, and I'll be sure to get to your questions when we get closer to the end of the presentation. So for those who might not know, Covenant Health, while Catholic affiliated, is a public healthcare partner of Alberta Health and Alberta Health Services. And so as part of the province's integrated healthcare network, we manage and operate a few hospitals. So if you're like me in Edmonton, the Grey Nuns Hospital and the Misericordia Hospital are likely going to sound familiar to you. Those are operated by Covenant Health. If you're in Banff or if you visited Banff and seen the Banff Mineral Springs Hospital, that's also a Covenant Health facility. And I believe we have 4 other hospitals across the province, but we're also very much involved in continued and long-term care. So in Calgary, St. Marguerite's Manor, St. Joseph's Home in Medicine Hat, St. Michael's Health Center in Lethbridge are all examples of Covenant healthcare facilities, and there are a number of others. But the Palliative Institute is the branch of the Covenant Health that my team and I represent, and we partner with AHS on community and public engagement, on research in this space, and advocacy around these kind of 2 topics of advanced care planning and palliative care. And our goal is to ensure timely access to high-quality palliative care across the province, and to advocate both provincially and nationally for a robust palliative care system. And so while my team isn't involved in direct palliative care delivery, Covenant Health certainly is, but our aim at the Institute is to equip Albertans with the information and awareness that'll hopefully lead to the best possible quality of life and for you getting the care that's right for you. And so moving on to this discussion of advanced care planning, or ACP, but I'll try and avoid that acronym. We'll start with the definition of this term. And so in a broad sense, ACP, advanced care planning, is how you think about, how you talk about, and how you document the health and personal care you want to receive now and in the future. And so advanced care planning is for every adult at any point in their life. And while we certainly recognize that this isn't always possible, it is best done when you are healthy and when there isn't an urgent need to. And there are some components of your advanced care plan that you might not ever need. But if there's ever a time that comes where you won't be able to speak for yourself, whether it's due to injury or illness, you'll be glad that you gave it the thought that you did, that you had the discussions that you did, and that you documented it the way that you did. And so advanced care planning is important for a number of reasons. First and foremost, because it empowers you to have the say in your care if at any point in the future you become too sick or injured to speak for yourself. It reduces the stress and the chances of conflict emerging among your loved ones if and when important decisions have to be made. and it provides you and your loved ones with peace of mind. It can also help healthcare providers offer the best possible care because they'll be equipped to understand what your priorities are, what your values are, what your wishes are. And so, in short, it is the best way to let the people who matter most to you know what's most important to you. So far I've defined what advanced care planning is in a general sense. We know it's for all adults at any stage of life and health, and we know it's best done when there isn't an urgent need. But I do want to define it further by going over what are recognized to be the 5 steps of advanced care planning so that it's a more manageable and more rewarding journey for you. And so we'll go over all of these steps in more details, but as you can see on the slide, these are in order. First, to think about your values and goals, to learn about your own health, to choose someone to make health and personal decisions for you if the need arises, to share your wishes with your loved ones and your healthcare provider, and to record your wishes, ideally in a document called a personal directive. And we'll talk more about that in just a few moments. But again, those steps are to think, learn, choose, share, and record. So that first step, to think, involves asking what matters most to me. And so some of the questions you can ask yourself to suss that out in a bit more detail. First is, who are the most important people in your life? What brings you joy and makes your life meaningful? Do you have spiritual, cultural, religious, or moral beliefs that are important to you? And if you were to get very sick, knowing that that might change circumstances for you, might change priorities, what would matter most to you? And there's no wrong answer to any of these questions. Your responses can be about family, they can be about how you spend your time, holidays, tradition, work, education, where you live, what you love to do, what you love to eat. It's just that knowing what matters to you can be a huge part in helping to make our lives enjoyable and worthwhile. And it's for that reason that it's considered the first step of advanced care planning. The second step is to learn about your health. And so if you're doing advanced care planning when you're healthy and there isn't an urgent need to, this might be a relatively easy step, but we recognize that's not always the case. And so if you are someone who's living with a serious illness, or you care for someone who has a serious illness, it's important to understand what that means in realistic terms. And there are 3 questions. They're actually brought to us by Health Canada. And these can help provide what we like to call the bird's eye view of your health. And these are, number 1, what does it mean to have this illness? Number 2 is, what can I expect now and in the future, now that I have this illness? And number 3, how can I prepare for what comes next? So again, what does it mean to have this illness? What can I expect now and in the future? And how can I prepare for what comes next? Are all 3 good questions to ask your healthcare provider if at any point you were to be diagnosed with a serious illness. The third step here involves sharing, involves choosing rather. And really it if you were too sick or injured to make decisions for yourself, have you chosen someone who can make them for you? And in Alberta, this important advanced care planning decision is called identifying or appointing your agent. And your agent can make health and personal decisions on your behalf only if or when you are not able to do so for yourself. And you can pick 1 or more people to be your agent. But some considerations for when you're choosing your agent should be, do you trust this person to make those important decisions for you? And do you trust them with the sensitive information about you for them to make those important decisions? Does this person know your values and your wishes that would help them make decisions that are representative of your care and the care that you want to receive? Can this person communicate clearly in times of stress, understanding that a circumstance where you might not be able to speak for yourself would very likely be stressful for that individual? And also, can this person make difficult decisions in those kind of stressful times? Moving on to the 4th step here is to share. And this step involves talking to the people that matter most to you, as well as your healthcare team, about what matters most to you. And talking to others about what's important in life to you, what gives your life meaning and joy, what's important in your health and personal care, all things that you hopefully would have considered during that first think step. These are all great ways to have these meaningful conversations. And sharing with others helps to make sure that any help or care that you might receive in the future when you're facing illness or you're facing difficulties aligns with your actual preferences. And so your family or others important in your life may have the best of intentions and they may think they know what you would want in those circumstances. But the best way for you to ensure that's the case is, of course, to talk to them. And coming to the fifth step of advanced care planning, the last one is to record your wishes. And ideally, again, this would be in your personal directive. And the personal directive is a legal document here in Alberta that outlines your health and your personal care instructions and who you would like to make those decisions if you were to become too sick or injured to speak for yourself. Again, that individual would be your agent, or if more than one individual, your agents. And other things that you can have in your personal directive, in addition to naming your agent, is if there are any medical treatments you do or do not want. And you can list those. And so some common ones that might come up is whether or not you'd like intubation or whether or not you'd like transfusion. Those are things that you can define in your personal directive. You can also define where you want to live and who you would want to live with you, as well as who you would like to visit you if you became too sick or injured to speak for yourself. You can also include other personal or legal matters, like around recreational activities, whether you remain employed, whether you pursue education. Those can all be defined in your personal directive. And so your personal directive helps your agent make decisions that align with your preferences because it's written down in a legal document that they can refer to. And so it's a great way to supplement those discussions that you've hopefully had with them during that earlier share step. And so many of you might already have a personal directive. I think my blur is on, but like it's often in a green sleeve, and you are often asked to keep that on your fridge. And so if you've gone to a lawyer to complete a will, there's a good chance that you also might have completed a personal directive. But if this isn't the case, you should know that you can create a personal directive, obviously with a lawyer, but also on your own. And if you wish to create a personal directive on your own, the government of Alberta provides a personal directive form that can serve as a template. And so it asks many of those same questions that we've gone over today. And when you complete it, it ensures that you complete the steps that make it an official legal document that will then help guide the care that you receive in the future. And so I understand that I've so far covered quite a bit of content and I've gone through it fairly quickly, but I just want to ensure all of you that there are resources to help if you want more support in advanced care planning. And so I'll provide a later slide that provides more resources, but one I just want to spotlight here today is one that we've created at the Palliative Institute called the My Wishes Alberta Workbook. And it's a fillable workbook that guides you through the steps we just covered by encouraging you to identify what's most important to you as it relates to life, health, and personal care. And it prepares you to have those conversations and those discussions with the people you love. It does not replace a formal advanced care planning document like a personal directive, because the aim is more to assist you to be better prepared to complete something like a personal directive or a will, because you've thought about it and you've had those discussions with your healthcare providers and you've had that discussion with your loved ones. And so it is available on our website, which is compassionatealberta.ca. I can put that in the chat in a little while. But we're also happy to send you physical copies if you would prefer. And I'll provide my contact information at the end of this presentation, my email and my work phone number. And if you wish to, feel free to follow up and request that I mail you this workbook. I can send you one for yourself. I can send you two if you wish to complete it with a spouse or a partner, or if you prefer that I send you a handful so you can share it with friends or family. I'm absolutely willing to do so. I just want to note here that it is adapted from a national resource called Coming Full Circle, but has that Alberta focus. This was done in collaboration of Canadian Virtual Hospice, which is a national organization, as well as in consultation with a circle of elders and knowledge keepers, and with the advice of an Alberta-specific work group to ensure that it reflects an Albertan reality. Now, next, I want to talk about palliative care here in Alberta because not everyone who can benefit from palliative care might necessarily know about the supports that it offers or where and how to access it. I'll start with a definition of palliative care, which you can see here is the care that one receives to relieve the symptoms and the stress of living with a serious illness. And those symptoms can be a variety of symptoms. They can include pain, they can include fatigue, they can include social isolation, grief, and much more. And so palliative care is focused on helping people have the best quality of life. And so palliative care is provided to people of all ages and abilities who might have a serious illness. And it's available from the time of diagnosis with a serious illness. It's important to think of it as like the extra layer of support that help people live as well as possible. And so while it can certainly include something like comfort care that we might associate more with a hospice care setting, it does go well beyond that. I hope this one image here just tries to illustrate what I mean by that, because palliative care is really for the whole person. It's not just about your physical well-being, although it certainly includes that, but it also includes the person's emotional, their social, their cultural, and their spiritual well-being, recognizing that these are all interconnected. So emotionally, it can help with things like anxiety, depression, and grief. Socially, it can help when people are facing social isolation or family conflict. And for those who consider themselves religious or spiritual, it can also help engage in activities that support that spiritual well-being and maybe answer some of those questions you might have. This other image, I hope that demonstrates that palliative care uses a team approach and an interdisciplinary approach in supporting patients as well as their caregivers. And so this can include family doctors, sure, but also nurses, social workers, spiritual care providers, paramedics, physiotherapists, occupational therapists, volunteers in your community can even help provide palliative care. And so some healthcare providers have received special training in palliative care to address the more complex issues that come with someone living with a serious illness. And these providers are often called palliative care specialists, but not everyone will need to see a palliative care specialist. It's based on where they are in their illness journey. A care provider might make the referral to a palliative care specialist, or might think it's a better fit for you to contact one of these other professionals, that might be a better fit. And so this can sometimes create a bit of confusion because someone might think that because they're not receiving a referral to a palliative care specialist or team, that they aren't eligible for palliative care. And we're hoping to address that here today. And so where to access palliative care if you feel that you or a loved one need it. The first step is often to talk to your family doctor or another primary care provider about how you or that person you're caring for could benefit from palliative care. And do you or they need support with specific symptoms? Do they need mental health supports? Do they need help addressing something like social isolation? You can start to have that conversation with your primary care provider. And these professionals will be able to either provide this care or hopefully they might provide a referral to a team or provider who can if they're not able to. And so if you or the person you're supporting don't have a primary care provider, we always encourage you to please reach out to 811, which is the public health number that's available to all Albertans. And I also just want to stress here that some care programs, an example is Alberta Health Services Home and Community Care Program. They don't require a healthcare provider's referral. And so if you feel that you or a loved one could benefit from a certain kind of palliative care, but you don't feel like you're getting the direction that you feel like you need at this time from your discussions with a provider, again, we strongly encourage you to reach out to 811. And so what services are available, it's true, may vary by which zone you live in, and how palliative care is delivered might look a little bit differently based on where you live. But I really just do want to stress that there are generalists and there are specialists in palliative care across Alberta. And a great way to connect with them, of course, is through 811. So we'll cover more resources available to you in just a moment, but I also want to draw your attention to a resource we've developed called Understanding Palliative Care. It's an interactive and self-directed online module It is accessible on our website, again, which is compassionatealberta.ca. There's no login required. It can be completed at your own pace. It includes a self-assessment quiz at the end if you want to check your understanding, but it's not necessary. And it was developed with a public Alberta audience to ensure that it uses clear, non-technical language that is easy to understand and to share with your loved ones. And so this, like our My Wishes Alberta workbook, is free. All the resources that we offer at the Palliative Institute are free. And we also understand that this medium might not be a good fit for everybody. So we've also developed a one-page handout that summarizes the learnings and the resources that this module covers. And so, like with the My Wishes Alberta workbook, please, if you wish to learn more or you want to receive a copy of this handout, I'll be providing my contact information at the end, and I really just do encourage you to reach out. I did promise that I was going to go over a few more resources that are available to you, and so this slide just covers a few of those around advanced care planning. Of course, as members of the Cooperative Memorial Society, where it comes to considering your funeral planning, they are a great one-stop shop for you to connect with and get more resources and information about that. In other areas of advanced care planning, there is the national website run by Advanced Care Planning Canada that does provide, when you visit it, more provincial-focused resources. But also My Health Alberta, which of course is operated in partnership with Alberta Health Services, has a dedicated advanced care planning page. But I really encourage you to visit if you have any questions about advanced care planning. And then, of course, there's our website, compassionatealberta.ca. One of our web pages called Plan Ahead is devoted entirely to advanced care planning. And it has, in addition to the resources I spoke about today, some other information and resources. And then in terms of palliative care resources here in Alberta, again, another national resource available to you is the Canadian Virtual Hospice website. It has a variety of supports and information about advanced illness, palliative care, and even grief. Like I said before, My Health Alberta is a great resource developed in partnership with AHS, and they have a dedicated page on palliative care with information regarding palliative care resources and where to access them here in Alberta. And Cancer Care Alberta has a dedicated psychosocial oncology team that's available to those living with a cancer diagnosis here in Alberta. And so they're a great resource to touch base with if you or a loved one is living with that diagnosis. And I've already talked about 811, which has some great resources related to public health. But also there's 211, which has a website, or you can dial it on your phone, and it is a great online resource to resources, teams that can support you, and they can even help identify some that might exist right in your community. And so that, I think I'm just around the 20-minute mark, maybe a little bit over, but that brings us to our question time. Pause here for just a moment, and then I will just move to the next slide, just so if anyone is interested, there is my contact information. Again, it's my email is there, as well as my work phone. Just going to take a look here because I'm seeing some movement in the chat, but I will see. Thank you so much, Terry, for sharing some of those resources. Christian, you as well.
I have a question here for you, Tyler. Beyond a personal directive, are there other important advanced care planning documents that Albertans should have?
Yes, that's a great question. We kind of refer to them as the big three, but we can even add a fourth there. So the first, the personal directive, which I've gone over, and then I also alluded to your will, which is another important advanced care planning document, which of course would outline your estate plan. The other is your enduring power of attorney. Sometimes this is shortened to EPOA, I think, enduring power of attorney, yes, which identifies the individual and the circumstances that you'd like your financial matters to be taken care of. And then important fourth one that I would add to that, of course, is your funeral plan.
Right. So we have a lot of this information on our website. So we also point people to the CMS website for assistance with wills and enduring power of attorney and all of that. So again, the link is in the chat, and you can also go to our website to look it up. I have another question here. What happens if somebody has not named their agent? And or what happens if somebody does not have someone who can be their agent?
Right, those are both good questions. So if you have not named your agent, there is a piece of Alberta legislation that identifies who your agent is. And I don't have it on hand, but it does work through your familial relations in a sequenced order. And so if you're married, I think the individual who is your spouse would be the default agent in that case. Of course, if they are living and are able to make decisions. After that, I believe, I can't recall which comes first, if it's your children, if they are over 18, or if it is your parents, if they are living and able to make your decisions. And then it kind of also works through that sequence. If you don't have anyone to be your agent, there is an agency here in Alberta called the Office of the Public Guardian and Trustee, often shortened to OPGT, and they can step in to make those decisions for you. And in your personal directive, if you're using the Government of Alberta template, there is a space for you to identify if you wish the OPGT to be your agent. It does prompt you, and this is very necessary for you to contact the OPGT if that is the case. And they can have that discussion with you if they think that's the best fit. And if they agree with you, then they will, of course, agree to be your agent in that case.
Great, thank you. We have another question here from Gail. It says, thank you for the great presentation, Tyler. Can you speak a bit to MAID, medical assistance in dying, as part of the planning process for those who are eligible and inclined?
Yes, yes. So when it comes to advanced care planning, really what like some of what we're saying here is what can happen if you lose capacity, if you become too sick or injured to speak for yourself. And currently, it is our understanding from engagement with the legal community and the healthcare community that here in Alberta, because you need to have capacity to make the decision to pursue medical assistance in dying, it isn't something that can be carried out if it's included in your advance directive or in your personal directive. That said, through some of the communications that we've been having with both those communities, the legal and health community, and I just want to stress here that this isn't legal or health advice, but just information that I'm sharing here, that it is still something that you can include in your personal directive if you wish to, because your personal directive really exists to be your voice if, again, you become too sick or injured to do so. And so there are some that say that it is still a good idea, if that is your wish, to include it in your personal directive, just in case at any point in the future the law does change and it does allow something like that to be carried out if you were to lose capacity. So I hope that answers your question, Gail.
Okay, I'm not seeing any further questions. Tyler, on behalf of the Cooperative Memorial Society, I just wanted to thank you very much for your very insightful presentation. We will post a recording of it on our website in a few days, so people can tune into that as well. I have a few people that are raising hands, but we can't respond to raised hands. You'll have to either put your question in the Q&A or in the chat. So we'll just give it a moment to see if there are any further questions. But I think all in all, what I'm seeing is lots of clapping and hearts flying up from my screen. So that's very positive. So I'm not seeing anything else coming in. Yeah, we're just getting reconfirmation that ask the questions in the Q&A section, and we don't have any in there. So again, once again, Tyler, thank you very, very much. Appreciated. We have your links on our website, and we encourage everyone from CMS to take a look at the website to learn more about the other resources that we have available as well. Thank you, everybody. Sylvia, did you want to say a final words before you close off?
Thank you, Terry. Thanks very much, Tyler, for the informative presentation. Thank you to all the other panelists for your participation. And most of all, thank you, members, for participating in this process. I hope you will all have a wonderful year, and I will see you next year from a different position. Goodbye.
Bye.